So, welcome, ladies and gentlemen, and welcome, ladies and gentlemen. So, we are going to try and discuss in 44 minutes and 46 seconds the issues about the next potential global pandemic. So, I think, Ankit, you wanted to talk about health, equitable access.
Yeah. Good afternoon, everybody. I'm Ankit Shah. And I'm a management consultant. Over the years, I have advised senior leaders at pharma and biotech companies on clinical and commercial operations, organizational growth strategy, and lately there's a big boom in terms of utilizing advanced analytics and data technology. For this panel discussion, I'm focusing on global health equity, which I see is a very important topic to discuss. Especially when we are considering from the lens of the next global healthcare crisis. Excellent.
And Mazen, you wanted to talk about pandemic and health hazards.
Yes. Actually, it is, the fear of every guy who's living, in this country, actually, and I'm sure in other parts of the world as well, that are we expecting really a second pandemic or not? And if yes, how we are going to face it, and are we ready to face it or not? And I have couple of points of views to share it with the audience and to share it with the panelists as well. How we can really do our best to stop it where before coming or before reaching to us.
Okay, that's very interesting. I think we need to delve into that in a little bit more detail to understand it. Dominique, you want to talk about mental health issues?
Yes, I do. We already had a couple of fantastic sessions here, actually, in the last 2 days as it pertains to mental health. And when we got this topic about global health crisis, there were probably 3-4 things that I could say, let's talk about, and interestingly, they're interrelated, actually. But I believe personally, the mental health crisis is already here. So I think we're living it, but I think we haven't recognized it as a global health crisis.
Thank you, Dominique. Yes, I agree with your assessment of the mental health crisis being here already. So the estimate is that 1 in 4 people in the UK will suffer mental health issues during their lifetime. That's adults, and 1 in 10 children will have a major mental health issue. Also, I'm an oncologist. We suffer daily grief of our patients. The rates of mental health illness in oncologists has been reported variously as being 30 to 60%. Also, I think relevant is the fact that suicide rates amongst physicians are higher than the population average. So, estimate of suicide rates among male physicians is 1.4 times higher than population average, and female physicians is 2.27 higher than population average. So I certainly agree that we are in a mental health crisis already. The other things I think we might consider are the current obesity crisis that is sweeping the world. I read an article this morning saying that if we actually use a more sensitive assessment of obesity rather than BMI, using DEXA imaging of body fat, the current obesity rate in America is 75%. I'm sure it's not far behind in the UK. We're the most obese country in Europe. Also, I think one thing we might consider talking about is the workforce crisis in the healthcare industry, which is, I think, on us already. The successes that we've had for delivering treatments has put excessive strain on us, and also has led to increasing rates of mental illness within the workforce. So, how are we going to divide up the time that now remains of 40 minutes? So Mazen, could you just explain a little bit more about what you think is the pandemic issue that's coming towards us, rather than the ones that we're in at the moment?
Actually, when I revise how we suffered during the first pandemics, which has been, I mean, running all over the world, actually, it was here in the United Arab Emirates, we have suffered a lot, actually, until we could govern it and we could stop it where it is. You know, I think the first lesson which should be taken from the first one is to study, I mean, what were the weak points which we have faced during the first pandemics, and what were where were our weakness there, not only in our country here, but in all over the world in the different countries, what they were facing, what were the problems they faced, and how they have solved. I mean, if all these problems and these obstacles could be collected together, I mean, and a committee could discuss all of this together to be able to avoid them, God forbid, I mean, if there is any coming pandemics, because as you know yourself, actually, in case of pandemics, it is not the responsibility only of the government, it is the responsibility of everybody living in the country how to fight and how to be ready for that. And to be able to have the whole community, governmental as well as public, as well as I mean, insurance companies, as well as everybody, it needs a lot of work. It needs a lot of work, first of all, to make sure that you are ready really with your resources to face these pandemics or not. Do you have stockpiles which can be enough, like the problem which we faced in the first pandemics? Actually, we were out of it. I mean, I would never forget that we as doctors, we used to donate and to collect money between each other to be able to buy the masks and to buy the sanitizers and to buy other things to be able to protect ourselves and to make it as a stock for the hospital. So all these issues which we have passed through, it should be studied, actually. It should be studied, and we should put really a clear strategy for that. One of the big problems we have faced as well was the insurance companies. We were speaking about insurance and how the insurance behaved and behaving. Actually, insurance was not ready to cover any pandemics. I mean, that was an extra cost on the private hospitals as well as on the government itself. So, I mean, if we start from now, the discussions and the convincing of the insurance companies to be part of any pandemics, of any common things which are coming to the country, which are out of the contract or out of it would be a great help to the whole community. You know.
Yes, I think that's very important. Of course, the pandemic would probably have been classified by insurers as an act of God, which they were not responsible for. Ankit, do you have any considerations on this topic?
Yeah, no, I think, all relevant points. I wanted to kind of, throw a light on something called reciprocity. I think when we were tackling the pandemic, we observed that countries that had advanced healthcare and the reciprocity that they shared with the low and medium income countries, I think that was very critical. And I think when we're looking from the global public health perspective, we need to understand that equitability starts with the responsibility of these advanced nations to do more in terms of providing their infrastructure, sharing their resources, their talent to the countries they might not have the best or they're emerging. And I think that is one of the key tenets that I feel that was the lesson learned considering the COVID pandemic. The second thing I wanted to kind of talk about is that going back to the equity, right? In an utopian world, any population cannot there should not be any barriers of any systemic or socioeconomic or geographic in terms of accessing the healthcare. But unfortunately, that is not the case. And I think that goes through the three main areas. One is, the global burden of disease. There are a lot of unmet needs which we need to understand. For instance, a drug that might have been, approved, let's say by FDA in the US, there are varying number of years it takes until it reaches, let's say, Asia or Africa. And I think that itself is, it is a tremendous burden on the disease and how we are tackling the treatment options. The second is, in terms of the infrastructure. So the government, the Ministry of Health of each respective nations, I think they really need to do their due diligence in terms of the fiscal planning. I understand that, funds might be limited, but I think with proper planning, we can at least optimize the use of the funding towards the healthcare. And I think it's also, partly the interplay between the policies and the regulations that are set in place. A lot of times, the access of the medication itself poses an immense barrier that the population is, not able to, undergo the treatment, which might, increase their quality of life or decrease the morbidity and mortality rate in that particular country. And I think lastly is the interplay between the 4 Ps. Providers, payers, pharma companies, and patients. I think we have to look, collectively. A fragmented approach of, tackling healthcare will not help. So I think these are the current areas that I feel have emerged, especially when we are looking, the lessons learned during the COVID pandemic.
Thank you very much. Dominique, do you have any comments on the management and running of the pandemic across the world?
It's interesting actually as I'm listening to both of you, because these are big issues clearly. And from my perspective, through my lens, looking at the element and the power of lifestyle medicine, it is so interesting to see. The pandemic has shed incredible light on this subject. The pandemic has actually magnified mental health. It has magnified what problems we actually have. We also know, if we went through the statistics, that people who are overweight or obese were more likely to be suffering from the virus, etc. So we know that actually there, from that perspective, a lot could be done. So I see that there is an interconnectedness, or exactly what you talked about. So lifestyle medicine talks about healthy lifestyles, which in essence, if I can be quite maybe direct, is free for the most part. So I think we're not utilizing a lot of these elements to bridge the gaps, which is so unique for this conference, because we're coming together to see how can we bridge the gaps, where are the connections there, how can we together bring that forward. So I guess as a last point to this, I think that lifestyle medicine could be an incredible key to a number of these elements of how to prevent or how to prepare as these things are coming.
Thank you, Dominique. I think we'll go on to that a little bit more just shortly. Clearly, I can't really comment on the management of the COVID crisis in the UK. We're just entering a public inquiry into the mishandling in the UK. And we know, of course, that we had major problems in our hospitals with access to equipment essential to keep our healthcare workers safe during the pandemic. And we know that nearly all of those involved in the pandemic, managing patients and seeing daily deaths, suffered major mental health issues. So I think that might be a good point to go on a bit more onto your topic, Dominique, of mental health. And I think what you're trying to talk about is a holistic approach to the human entity that we have. Perhaps thought about health care as a separate issue. It has been raised in a number of the other sessions in this meeting that what we should be trying to concentrate on is healthiness rather than illness. There's a lovely talk yesterday about the fact that we spend nearly all of our money on the 20%, which is the illness, and we're not concentrating on the healthiness that we should all be aspiring to.
Yes, I agree with everything that you're just saying. If I use this as an example, so interesting. Knowledge is not the same as putting things into practice. And I think we all suffer from that disease. We suffer from knowing a lot and not transferring it. And if I look at, for example, this conference, it's a perfect example. I'll be a bit critical, but most of the day we spend sitting. right? So we sit and sit. And so we actually employ unhealthy lifestyle practices in our day-to-day life, and we're not acting, you know, as examples to maybe the patients or the people that we're working with. And I actually, this morning too, I was trying to pull some more last-minute numbers as they're there, and that's why I have my little book to tell you the true numbers. But a 2023 Gallup poll actually states, or a global study, that 44% in the world of workers feel stressed. They are stressed at work. So nearly half of the people that go to work are stressed. Stress, we know, leads to a number of issues. And so we're seeing an increase in all of this. The numbers say that mental health across all ages, genders, cultures mental health has been decreasing, so the health is getting worse. And so the numbers are telling us that we are not implementing what we know. And I think this is really where right now the rubber meets the road, is that what are we going to do with this consistent understanding and knowledge of the power of the simplicity, too, of what can be done. For that, we need to change the way we think about how we do things.
And how would you recommend that we do that?
Well, so first and foremost, I really think, number one, for the entire healthcare community, I don't care from which sector we're coming from, I think an essential additional piece of being educated about what is lifestyle medicine, what are the key elements of lifestyle medicine, and how can we implement them into our structure, into our hospitals, practices, workplaces, whatever it looks like, in a real day-to-day basis, and that we can utilize the lifestyle medicine certifications for the medical health professionals, for starters.
Excellent. Ankit, do you have any views on mental health issues and how they impact on workforce environments, on populations, and how would you go about addressing the issue?
Yeah, no, I think it is definitely, you know, one of the areas that we really need to think and do more. I think if I have to, you know, look from the organizational perspective, I think what happened is that the lines between the personal time and the professional time, because everybody was working from home, it blurred. And while initially, you know, it was, you know, great that, you know, we were saving on the travel time, we were more efficient, but then the burnout also, you know, started to happen quickly. And I think that happened is because there were extended meetings, a lot of Zoom fatigue, and, you know, the decrease in the time of the personal time from the family, which was dedicated because there was a clear segmentation of the personal and the professional time because everybody was going to the office. Unfortunately, I think that led to a lot of, you know, increase in the stress levels and not, you know, thinking in terms of, or not putting a lot of emphasis that this can have, you know, a lot of repercussions to follow. So I do agree. I think what we really need to do change is that regardless, you know, we are working from the office or we have working from home, I think we really need to establish boundaries for ourselves of what we are able to, you know, provide in a 24-hour, you know, in one day. And we need to kind of like think and understand that, okay, this is the commitment that I can provide, you know, to the professional time, and then also look into, you know, some of the relaxing and you know, the stress burning areas, be it, let's say, you know, you can work out, you can, you know, do whatever hobbies that you're interested. I think these are very small little things, but it does, you know, contribute into increasing your lifestyle and, you know, bringing down the stress. So this is what I felt from my personal experience.
Thank you. Mazen, do you have any views on?
Yes, I think, I mean, the mental health actually is one of the most crucial points which should be stressed on if really there is any, like the problems we have passed through the pandemics. Because if we study from what we have passed through, I mean, the fear of the people by itself brought them into depression, brought them into committing suicide, brought them into the fear of the vaccination, where there was no transparency about the vaccination, where there were too many rumors about the vaccination. I mean, that brought the whole population, actually, in addition to the physicians themselves, into a miserable state of mental health. Actually, we were all depressed. We were all afraid that when our turn will be coming, you know, My colleague has been affected. He's in the ICU. He is suffering between death and life. The other one, the next week, was admitted as well, when my turn will be coming, and so on. So this mental health, in spite of all the problems we were facing, it should be stressed on, and it should be dealt with strongly during any crisis or any pandemics. And it is required from the World Health Organization, from all the people who are in charge, whether ministries of health, or to let the public contribute in decision making, to let the public share the transparency. Okay, the vaccinations are necessary. They have side effects. Why shouldn't I tell about the side effects of the vaccination? They should know the side effects of the vaccination, and each one then is free whether to take it or not to take it. But to make the things obscure, and then after a couple of months to say, oh, it is causing meningitis, causing encephalitis, it is causing disabilities, and so on. So actually the mental health during the crisis is one of the most important points which should be taken care of.
Thank you. So I think we'll go on a little bit to discuss the mental health crisis that we're facing at the moment, not just related to the pandemic, because we're all under extreme pressure in our work-life balance. So I found a great quote by Einstein this morning. Just came across it like you do. So he said that I think about a problem 99 times and I do not make any progress. I go for a swim once and the answer comes to me. So I think there is a lesson in that working too hard is not always the most productive way of getting to the answer. And at the end of the day, we are what we think, and actually what goes on in our heads is everything. So, shall we carry on talking about mental health issues, or shall we talk a bit about obesity and the interplay maybe of those two things?
I would love to.
Go ahead then.
Well, really, like you just said, these things, of course, again, are interrelated. The obesity epidemic has been going on for a long time. I spent over 20 years in the United States, and you already mentioned it. It's one of the biggest issues that we're facing because of all the things that are connected to it. We now know that a person who is overweight or obese more than likely is physically inactive or not as active as they should be. Once you also study obesity, you know, of course, that physical and mental health have a correlation there. So everything is connected around that. And the obesity epidemic really has so many victims every single year. We're losing more people to obesity than many, many other things that we focus much more on. And we are not utilizing focused interventions on that. So it's a complicated issue because now we would have to go into also the media and we have to talk about what's being offered and how our entire system functions. But the key thing that I believe in, again, is that if we started to implement basic things also in society that are the norm. So for example, I use the conference, right? So if any academic meetings or meetings at work standardized would be happening standing instead of sitting, at some point it would become normal. Right? And so you just mentioned it with a quote. It was brilliant. In our topic, it says, the next global health crisis and how we can prevent it. That sentence means we have to take action. Without action, nothing is going to happen in terms of prevention, right? So we have to change the way we do the little things so that it becomes normal. Because if you think about the children growing up, and the children watch us at the workplace, at home, we're moving, it's part of a daily lifestyle. We are eating fruits and vegetables as snacks instead of the things that we eat as snacks, etc., and so on. We would start making changes, systemic changes. And so, to me, if we are not going to start doing, I'm giving just 2 examples of many, many on the list, but if we're not going to do that, we're going to have a severe, massive crisis that's going to impact workforce, it's going to impact productivity at work, and a massive impact on the economy, etc. So it's all a chain reaction.
I totally agree with you. So Ankit, so I'm part of the Inequalities in Health Alliance, part of the Royal College of Physicians, and we wrote a paper to the government in the UK. Clearly there's an inextricable link between housing, income, deprivation indices and health. And actually the biggest problems that affect health outcome are what social class you are in. So for instance, in the UK, in poor quality housing, often there isn't even the ability to cook your own food. So these people who are the poorest and most needy in our population are often using takeaways and all the health issues that implicates, and they are often the most obese. Would you like to talk about obesity as a health inequality?
Yeah, I think I think when you're trying to kind of look obesity as one of the crises, I think there are a few things that come into my mind. I think the first is how are we trying to kind of tackle, and I'm going to mainly focus on some of the developing nations because they have double the burden of fighting obesity, even though the statistics have been increasingly even in countries like US. But I think when we look into a lot of these developing nations, one of the things that is lacking is in terms of the local manufacturing of the treatment options or the medications. And I think that itself poses a tremendous access to barrier to the access of the medications itself. You can surely try to kind of focus, and again I'm just going to play a devil's advocate here. Definitely lifestyle changes make tremendous efforts in trying to kind of prevent. But at the same time, when we're looking into the patient population who is actually suffering from obesity, they need to get on the treatment options. And what happens is that because there are very few companies and there is very few manufacturing or the localization of the treatments available, these countries have to rely on other countries in order to access the medication. And what happens is that because the government is not looking from the lens of health outcomes, from the lens of access, there are certain guidelines, policies, and regulations which are not conducive for patients to even get the treatments which is available in a lot of other countries. And I think that is something that we really need to change. A paradigm shift needs to bring, and especially, let's say, we have to think maybe if countries themselves do not have the means of setting up the manufacturing, there are a lot of opportunities in terms of, let's say, Dubai being an emerging health hub. If we look into, like, let's say, a spoke and hub type of a framework, Dubai can have a relatively easier access to the medication supplied to the African nations, to the Asian nations, and also to the Eastern European countries. So we have to kind of see from the geographic point of view how we can increase the innovation hubs, how we can set up the manufacturing of these medications so the supply becomes much more easier. And I think that is one area where a lot of work that needs to be done, and the focus has to be in terms of the pharma companies partnering and providing patient support programs, advocacy groups, specifically focusing in these countries, which is currently not present.
Thanks, Ankit. So, Mazen, I'm going to ask you to be arbiter between these two individuals, one propounding that we should be spending more on obesity drugs, and the other suggesting that we should be addressing the need and the education, I think, from the outset to stop people getting obese. I can see the benefits of what you're arguing, Ankit, but is there a role, for instance, for social engineering, education? How would you approach the issue of obesity?
Actually, I'm a pediatrician, and this is one of the major problems we are facing in our practice, the obesity of children. And for me, the obesity is not just a disease, it's a style of life. It is a way of life, how these kids are used to eat, how these kids are raised up. I mean, for the mothers, most of the mothers for the time being, they are working mothers. And that's why, I mean, for them, the fast food, the quick food, I mean, the sweets, they are the main supply of food for their kids, and too many mothers actually in the culture here and in other parts of the world, they love their babies to be obese. They love it, they enjoy it. They have the concept that, I mean, the more obese the baby is, the better is the mother, and the mother is looking after the baby, you know. So I think not only the kids who need the education, I mean, the mothers need more education and deeper education how to raise their kids more than the kids themselves. The kids are very poor. Whatever you give them, they will take. Whatever, if you tell them this is hazardous, they will not take it, and so on. But we are facing huge problems with obesity in our practice. You know, the simplest of them, a child who comes with asthma, and I need to put him IV line. If he's obese, oh my God, I mean, it will be really a very complicated task, and I have to call the anesthesia to help me to find a vein for that child whose the whole body is full with fat, and how to dig to find an access for him, and so on. With all the statistics all over the world has been proven that the obesity in childhood, I mean, is joined with diabetes mellitus, gastrointestinal problems, mental problems, I mean, asthma and bronchial diseases. I mean, all is a combination with each other, actually, which should be really stopped, not with medication. I mean, medication, I mean, cannot be given. I mean, the medication, how to, I mean, to depress the appetite cannot be given except after the age of 10 years and so on, or 6 years and so on. No, it is how to change the lifestyle, how to educate the mothers and how to educate the children, how to do it in a proper way. I think this would be the best.
Yeah, so population education, and I'm sure you do practice the individual point of learning that is always important. So as a breast cancer doctor, I always ask if you're a smoker, and that is a very important learning point to tell the patient and their relatives to stop smoking, and here's a learning point that you can tell the mother to try and address the weight issue of the child. So education is clearly fundamental. My daughter is currently finishing her university course. She's been doing politics and history, and she's been interested in the history of medicine, interestingly. And she was writing an essay on the interaction between the evolving data on smoking causing lung cancer in the 50s and 60s and the UK government policy on that actually not being very supportive because of the tax revenue. So, a controversial issue, taxing sugar products. It's been discussed several times in the UK. At the moment, it's been left to suppliers and producers to put labels which are of variable benefit. What's your view on taxing sugar? Ankit, you can start as you're jumping in there.
Yeah, no, I think it is a very dicey, topic. Some may say that, the proponents may say that, okay, the government should take a stand and do what is right for, their citizens. But on the other hand, it's also, the prerogative of the citizens to choose what seems right for them. So I think when we're looking in terms of, the tax benefits, especially from the government policy perspective, we need to kind of, measure what's the, the overall implication that's going to cause to the citizen in terms of their, the healthcare itself versus the revenue that has been generated, with the selling of, let's say cigarettes and other related products. So I feel like there is no clear answer to kind of like, 100% impose a ban versus, okay, 0% you have the free will, but it requires, a dialogue and, an open communication, between, the population and the government, and to understand, what is
Are you aware of anywhere that dialogue has actually happened anywhere in the world? Is the dialogue actually happening between the government and the industry that is purveying the toxin?
So it may not happen at a national level, but I feel like, in the pockets, I think Massachusetts has a great way to communicate, with the population and to understand that what is their perspective. Similarly, I think, California is also very proactive in terms of, understanding what are the, patient's needs. But then you have, certain states like Texas, who just has a more authoritarian way of, taking about policies. So I feel like as a nation whole, we might not be able to kind of bring one specific, and that is why it is important that the regional and the states take a very proactive measure. And there needs to be a little bit of, dissection in certain policies. And that we are also seeing in terms of the European Union as well. While maybe, certain countries might feel that, the taxing and certain percentage might be something that really need to impose just as a part of a broader scheme of policies. But then there are countries which try to kind of look in more of a minutiae or granularity of their citizens and act accordingly.
I can see you itching to jump in there, Dominique. Go on.
Your question is a really, really good question, because really there we're talking about this, the top-down approach to make changes. And I am very much at this point in favor of these conversations to be happening. But like you already indicated, where are they really happening at a serious level? That's a question. And just to give a mini case study to that, one of my last tasks in the United States was I was a chief wellness officer at a university who gave me a job description to make the university the healthiest university in the world. That was my job description, quite big. And so I started to tackle the various different elements of holistic health well-being. The first one was to assess the cafeteria, of course, right? And so I was at the cafeteria. They did a great job. They offered healthy choices, but they also offered lots of unhealthy choices. So going back to what you were saying, the student clearly was there and they could make a free decision. The free decision of most students was every single day pizza, French fries, and Coca-Cola. Okay, so then we surveyed the students, etc., and we actually pushed, and this was a long conversation, and this was not with, the United States president, just the president of the university and the committees. It took a long time, in fact, over a year and a half, to have the committee agree on removing sugary soda pop from the cafeteria and only offering flavored water options, right? And here's the interesting part. The entire committee says, we can't do that because people will be upset and so on. We did it. We didn't get one complaint from the student, not one, that there was no more soda. So this is very interesting. The policymakers had the issues, not the consumers. So just as a little case study of my experience at a very micro level.
Yeah, I think, given an opportunity and given the knowledge, many people would actually choose the healthier option. I think I'll draw to close our time on the stage, but thank you everyone for your thoughts and your great expertise. I'll open it to questions from the audience now. We've got 7 minutes and 52 seconds, so on your marks, get set, go. That microphone. Any questions from anyone? So who? Okay, young lady at the front.
So this is for the panel and not Andrew, because I know what's going on in the UK. So for the other countries...
You go a little bit closer to the microphone.
So for the other countries, what I really wanted to know is, in the UK, we've started with our primary school kids doing things like meditation, and it's all obviously very new to the more sort of the different generations. Do you do anything similar in your countries?
So I think the question was about meditation in schools.
Yes.
And introducing very young children to meditation. And is that an experience that you have come across? Meditation.
And to be honest, I didn't know what it was, but I know my niece and nephew do.
I mean, there are, of course, data suggesting that meditation in many instances may be as good as medication for people with mental illnesses.
Yeah, I mean, if the question is, as I understood, actually, whether it's allowed in the schools to, I mean, to give the kids the medications, I mean, for each one of the students, I mean, there is a list which is written from the parents what medications he's allowed to take and what medication he's not allowed to take. You know, I mean, what allergy the child is having and what are the things which he is not allergic to. And normally speaking, in this part of the world, in the UAE, before they give any medication to any child, except the life-saving medication, they would call the parents and take their permission. Before they give any medication, they take the permission of the parents, except, as I told you, if it is a convulsion or if it is something life-saving, where they have to react quickly before and then inform the parents about it.
Okay, so this was meditation?
Yeah, meditation, not medication. Sorry, they're very close.
Meditation.
Yeah. So do you have anything? Because you're from Dubai, is that right? So do you have anything, any sort of educational?
So I'm going to just take prerogative here and ask the audience who does meditation or yoga or something to try and help their well-being. Probably about half. Yeah. So I probably shouldn't ask that question because it's a bit intrusive. So in terms of... Okay, I'll ask it. You can abstain. So who in this room has had mental health issues? Many of us, yes. So, who has tried to adopt a healthier diet? Good. And for those that don't, what are the obstacles to trying to adopt a more healthy diet? We know that diet has many issues. There are many active agents that in the environment from which we develop drugs, and certain diets have been advocated for various reasons. But clearly, from a cancer perspective and cancer outcomes, the best diet is one by which you do not gain weight and ideally try to optimize your weight. There's huge data that say that this is actually more important perhaps than a lot of the very expensive drugs that we use. So who has a Mediterranean diet? Yeah. So I'll let Dominique ask the next question, unless someone wants to get up from the audience and ask a question themselves. Here we go.
Hi, thank you for the presentation. Mine is a quick question about... Sorry, can you hear me? Yeah? Okay. So, it's a quick consideration about the obesity, or being overweight. And this actually is applied to myself because I've seen this in the past. So, if you see someone smoking, would you challenge them? If you see someone with an unhealthy habit, would you feel comfortable challenging them?
So I would certainly challenge someone smoking in an environment where smoking is not permitted, which is everywhere indoors in the UK and increasingly on the doorstep, because once we banned smoking inside, we then you had to run the gauntlet of the smokers at the entrance. And all hospital sites in the UK are non-smoking, and unfortunately we still see people smoking. I challenge them directly. And say, this is a non-smoking site. And even if it's a cancer patient, I still feel I am right to say, you need to take that cigarette off the premises.
And would you do that with someone that maybe is a cafeteria eating, or, you know, is struggling because he's a patient, has been admitted to a hospital for any medical disease, and is still not really following the directions of a medical advice?
I think it's difficult, isn't it? Because we know that nicotine is hugely addictive. And also, once you're into an eating cycle, that becomes hugely addictive. So I try to do that in a non-pejorative way and try and be helpful rather than aggressive. And so also with patients that are smoking, it's, you try to give them the assistance to stop smoking. Dominique, do you have any views on this?
Yeah, absolutely. It's a very good question, and it's definitely, of course, very sensitive, the subject, no doubt. I'm personally a very, very huge supporter of creating positive social environments and also creating positive movement. So I personally would never, when it comes to, for the example you mentioned, with smoking, like you said, I would do it too. I usually challenge a smoker in a non-smoking environment. But with any other subject, to me, that's not the central focus. The focus is rather to employ a positive environments with positive practices, because we know that social behavior impacts other people's behavior, right? So if we get more people to do it, I mean, again, another example, if at a workplace, every worker at 10:30 takes a break together to go on a walk, even the people that never do it will start doing it because it's a positive behavior. So that's a much better approach, in my opinion, than confronting individuals on these particular health topics.
Ankit, Mazen, any comments on this?
I would just like to end, what I started with one sentence which came to my mind. To the time of our Prophet Muhammad alayhi afdal salatu wasalam, what he told us, if you want to live healthy, avoid two things, the two whites, salt and sugar. And this is coming now after so long, it's coming true, that if we avoid these two, and if we are logic with consuming these two, we will be able to live healthier, much healthier than before.
Very wise words. Thank you. And thank you very much to the panel. And thank you to the audience for attending. I'm going to wrap it up on time.
Fantastic. Thank you very much. Public Health Crisis Panel.